I'm Fatima. I'm from Richmond, BC. I'm your health and beauty social media queen.
Hi guys, I'm Chef Fred. I live in North Vancouver, BC, and I'm a health enthusiast.
Hi everyone, my name is John and I'm in Vancouver and I'm a work from home dad to 2 great kids and married to a wonderful wife.
Hi, my name is Cyrene. I live in Vancouver and my passion is health and beauty.
Hello everyone. Thanks for joining us for episode 2 of The Healthy Home. Again, if you would like to win this bestseller, you can go to our page, like the page, which is The Healthy Way Vibes. We'll put it in the comments below. And also you would have to like our page, share it, tag it, and make sure you're commenting on all these videos. By the end of the series, we will draw 4 of these books. So you may be one of lucky 4 winners of this amazing book, The Healthy Home, and it is the bestseller. It is also the bestseller, the top New York bestseller, and you can't get it on Amazon. So you definitely want to get your hands on this copy free. Anyways, so as the conversation continues, we are now going into our bathroom. You know, that's another place that we spend a lot of time is in the bathroom. Now, what's scary about the bathroom is we have a lot of, in order to make sure it stays clean, we have a lot of cleaning products. For us women, we have our skincare, we all have our oral care to worry about. We all have, also for women, we have our makeup. And then for guys, as well as for women, we have our cleaning routine, which a lot of times we don't think of. And then if you're wearing hairspray, if you're using gel, if you're using deodorants, a lot of times we don't think of what's actually inside of it. So, are you guys ready to discover what is sitting on your body?
Definitely.
Yes.
Let's go.
So, for the first one, let's get personal. Let's get really, really personal. So, how many of you guys actually are wearing antiperspirant? I did. And the reason why I would wear antiperspirant is because I sweat a lot. But I sweat a lot because of the fabrics that I'm wearing. So now, why is antiperspirant a really bad thing to be using?
It plugs your pores.
It plugs your pores, and there's also aluminum in there, which is a very heavy toxic metal. So the more you're putting that into your system, well, like John said, it's plugging your pores, and it's not allowing your skin to really breathe. So yes, you do have times that, you know, you want to make sure you're not sweating, like, because I do sweat quite profusely. And so, I mean, I also use my deodorant, but I don't want to be using it on a regular basis. So I could be using it, you know, as soon as I come home, wash it off. As soon as the weekends come along, you can wash it. You don't need to put it on, and don't put it on at night. You don't need it at night. Again, when we go back to what Fred was saying, this also applies to your products. You want to let your skin breathe.
Yeah, and that's the hard part because we all want to, feel confident, right? Because, sweating, showing stains and stuff like that is not confident inspiring. But antiperspirant is actually making your body stop doing something it's naturally supposed to do, which is to keep us cool. And so that's important. Like when you mentioned that you don't use it on the weekends or maybe in the evenings, is that some of these products last 24 hours. You just heard 24-hour protection. So if you don't get it off, like if you don't clean it off well, it's still going to be working. Like it's still going to be clogging your pores. It's still going to be sitting on your skin. And so that's more reason that, first of all, try to minimize the times that you do use it. And maybe there's alternatives. Maybe there's, if you're just going to go to the beach, you're going to be sweating anyways. I don't think you need deodorant or antiperspirant at that time. So kind of pick and choose. Again, we're not saying to stop everything. It's just minimizing and just being aware of when you need to and when you can eliminate, right?
Yeah, for sure. And then this was actually something that was really scary as to what I read, is that when you're using the antiperspirants, and if you're using a spray version of it, well, one, you've already lost like 30% of what you're paying for because it's just dissolved into the air. But what I found what was really sort of scary or interesting is that when you're using, if you take away the antiperspirant, it helps with um, your ability to process meat and not be craving the iron. So that comes back to, well, I'm anemic, and that was like an aha moment for me because I've been using antiperspirant for a long time. And in this time that we have been in quarantine, I haven't touched my antiperspirant, and I've actually been able to process the meat easier, and I'm not craving it as much. So that was kind of interesting to me.
Wow.
Yeah, it was an eye opener, a huge eye opener for me. So enough about the antiperspirants, but there is also our skincare and our oral care. What are the things that you're looking for according to the book?
I'm looking for something that's paraben free, preservative free. I want to make sure that whatever I put on my skin doesn't seep into, well, I know whatever you put on your skin will seep into your bloodstream, and I want to be as natural as possible. And I don't want to hinder my body by any ways. I want to make sure that it's healthy, it's helping my body.
Mhm.
So I like to experiment. I Google online to see what my options are. And that goes for cosmetics as well. And for me also, one step further is I want to make sure there's no gluten in it.
Mm.
Okay, excellent. How about yourself, John?
Well, it's kind of like going through the book is that, you know, some people put on anywhere from 6 to 15 products on their body before they even walk out of the house, right? And because we're staying home a little bit more for over the past few weeks, we've reduced that. So some of us have actually probably felt refreshed because we're not basically coating ourselves with all these products. And again, something out of the book, they said there's over 10,000 ingredients that can make up into making all these cosmetics and skincare products and personal care products that we use every day. So how much of that is kind of coming into what Cyrene is saying is being absorbed through our pores and into our skin? And so, if we're just eliminating one or two, maybe even three, we could be reducing 20-30% of our exposure day in and day out. And when this continues over 10, 15, 20 years, these things can come back and bite us. So if we can kind of just again, just picking your battles and just eliminating one and maybe replacing it with something else, right? Something with a healthier makeup of how they make it, and maybe eliminating an ingredient here or two. That it makes all the difference.
Yeah, for sure. Like perfectly said. And in the book they were saying that a lot of times that you want to go with unscented because like John said, you can easily use up to 10 to 15 products just before you leave the house, right? And so if you cut down on the unscented, so just imagine if they're having to put a scent in there, how much chemical are they actually having to use to make that scent, right? So the products that we would be using on a daily, well, it's like you've got your toothbrush, let's just start from like showering all the way to getting ready. So you've got like your shampoo, your conditioner for us women, and then for men it's probably just the shampoo, your body soap, and then maybe your skincare, like your cleanser, your aftershave, your shaving cream, your like your skincare routine, plus your perfume, your deodorant, antiperspirant, plus I can't even count now.
Cosmetics, your makeup,
makeup, your hairspray, your hair gel. Now
that's already over 10.
You're already over 10. I lost count of all of this. So imagine all these scents are fighting, and then our own body has a certain scent. So now it's like just overwhelming. So if you can even reduce, say, a few of them with the scent, well, you've taken a small step. In 365 days, you've made a huge difference.
Like we've all been in an elevator where someone comes in and they've got so much cologne and so much perfume on, and you just feel nauseous. And
Yeah.
so imagine, this is someone who's okay with it. Imagine someone that's got sensitivity to that, and I know that in my office before, they started putting up signs in the bathroom saying, please refrain from I guess, I don't know how you call it, but just cologne and perfume, because there are people that are very, very sensitive to that, and they can't breathe this in constantly. So, we've had to come to that, having
And the people that puts it on, they can't smell it anymore.
no, they're
No.
immune to it.
So they just put it on.
They keep getting more.
Because they're immune to it. you
Yeah.
know?
And the worst are actually smokers. You probably could agree to that, Fred, because it's like you go out for a smoke. Well, now you've got this scent of smoke on, and now you want to cover yourself, and it's just like, oh my Lord, please, like, get away from me. You already have that, so
Smoke
those are-
lingers. Even
Yeah.
though the smoker doesn't smell it, it lingers.
it lingers forever and
Yeah.
ever. And like, I'm one of those people that actually get, migraines from, scents and everything. So I was working at one of the offices, and there was a lady who had come in, and she was there for a meeting, and it was right beside my desk, because I was like I was the receptionist there. And oh my Lord, I couldn't wait for her to get out of there fast enough. And then I had to go into the room to to put all the chairs properly and everything. I was just done. I ended up missing 24 hours, 48 hours a month, because I ended up with a migraine,
Wow.
like
Well,
a
remember-
really bad migraine.
Well, remember, we're just talking about products that we put on ourselves. Like, imagine the bathroom, like you mentioned earlier. We need to disinfect and clean it regularly,
Yeah.
right? And so all these chemicals and cleaners and scrubs and mildew removers, they need to have chemicals in there to do their job, right? And so yes, they are keeping our bathrooms clean, and they are helping our environment to stay sterile. Clean.
Clean.
They don't have to. I mean, sometimes so what I do is I clean the bathroom, and I have to leave the fan on, like the ceiling fan on, for hours, because my kids get sensitive going in, and they don't want to have the place smell like lime. Like, yeah, it is lime and lemons, but it's just too overpowering. Like, it's just so strong. So I have to close the door and leave the fan going for a couple hours. And that, imagine you do that once or twice a week. That is, and sometimes you have to go in, right? You have to go in and use the bathroom while this is going on. And I'm the one cleaning, right? So imagine what I'm exposed to as well.
But there are a lot of safer cleaning products. Like bleach is something that I stay away from. Like, I won't touch bleach anywhere. Like, it's such a strong smell. But there are cleaning agents that are cleaner, safer, without any of the chemicals that have been in there. And also, like, if you're going to use lime, you can use an actual lime to do some cleaning with vinegar and baking soda. So
Yeah,
that actually gets it really clean as well.
So we have been switching. Like, we have started buying, again, we're replacing what we can. And also, that's the hard part, because we want something that's chemical free that can also do the job.
Yeah.
Right. And that's where the struggle is for a lot of people, is bleach kills everything, and we know it works, but the side effects is detrimental. So if we get something that's green, yeah, it may be safer, but does it still do the job? And so we've been lucky, you have to do your research, do what Cyrene does, Google, do whatever you need to do, and just find things that are just as effective or better, but without the side effects.
Mm-hmm.
If you don't want to make your own products, you can always buy eco-friendly products out there.
Yeah, that's what we've been doing.
Yeah.
Yeah, so there's a lot of options to keep it cleaner. Like John said, make sure the fan's running. And if you're fortunate enough to have a window, keep the window open.
Yeah.
Like, I mean, whenever I do my cleaning or whatever, my windows are always open. Just so I'm detoxifying, I'm degassing, everything. So it's also easier for me to breathe rather than having to breathe in the fumes as well.
How about Fred? Like, what did you have to do? Like, what kind of stuff did you guys use when you were cleaning the kitchens and the environment?
we'll use quad sanitizer, which is pretty harmless, but it kills the bacteria in kitchens. And in the bathroom, I probably we use like chemicals, but we kind of leave the window open, get the smell out.
Mhm.
And yeah, when it comes to products, you know, like a lot of the companies that creates product, they put the chemicals in there and they say, well, it's safe at a certain level. But what people forget is that product might be safe, but you're putting, like you guys said, like 6 to 9, 10 products on your skin. And then that level that was safe in one product, it's safe in the other one, but you're putting twice. So now you've got twice the safe amount, or 3 times or 4 times the safe amount. And it goes into your skin that absorbs pretty much everything.
What? You guys aren't wearing gloves? You're supposed to be wearing gloves.
Well, even that, you're breathing it in.
Cleaning.
What do you mean wearing gloves?
Wearing your gloves when you're actually cleaning the toilets or wiping your sink, or you're spraying the mirrors.
No, we are, but it's going through your pores, it's going through your
Yeah.
eyes, it's going down you're breathing
It's
it
what
in.
we breathe in as well. People now know that the skin absorbs pretty much everything, and all the natural scents that are created out there, like the mountain air and the fresh rosemary. Well, it ain't done with fresh rosemary. It's like it's done in a lab, and it smells like mountain fresh. But as the book says so well, and I like that, the best smell is no smell at all.
Yep.
Yes, I agree.
And you walk in people's home and it smells like spring in the middle of fall, right, or winter. And you know that you're breathing in all these chemicals that are creating those smells.
Mhm.
I have a friend who has an air freshener in practically each socket. So you come in and you go, and you're overwhelmed with these scents, which give you like a migraine, not to mention you can't breathe properly. We are like, we're here, like, okay, thanks for the visit. We got to go now.
Well,
That's your breathing pattern. Like, I didn't know that affects my lungs.
well,
It
how
does.
many of us have jumped into a car, like a taxi, and they have those little air fresheners in the vents,
Oh God.
and it smells like lemons or like the pine or even like strawberries.
Yeah.
Strawberries. But the thing is that you're encased in this little bubble because you're literally encased in this little greenhouse, right? The car for 15 minutes, 30 minutes on the ride. But imagine that now it's going into the fabric and it's going into the headliner. So every time you're going in there, it's almost like cigarette smoke. It gets everywhere, right?
Yeah.
And then so when that thing ends, you're plugging in another one and another one. So that cycle never ends. And I've been in cars where I jump in and I can't sit in here. It's lemons, but it's just so powerful.
It's very powerful.
Yeah.
We could keep going on and on and on about, like the smells and how they're not good for us and, the cleaners, but there's still a lot more that we do need to cover. So our next topic would be our pearly whites. How do we keep them white? So like you go to a dentist, and this one's going to be primarily you, Cyrene, because you did work in the dentist office, but I know like I hated getting fluoride, like the fluoride cleaning and whatever. And why is that the dentist, they use the fluoride, although they know that they shouldn't be using the fluoride?
That's the thing. It's a very tricky situation to be in because there's evidence that fluoride is bad for your teeth. It actually over time, anything over time is the key. It makes your bones brittle. Now it could be around your teeth or it could be inside your body. And you'll see fluoride in the toothpaste as well as in water. And the thing is, no one wants to have a lawsuit. So you can't say this is good, this isn't, this is better. So I'd rather just stick to that right now. And I'll talk to you about the mercury later.
Yeah. Speaking about mercury, that was something that scared the living daylights out of me, because how many of us have had cavities? I've got a really sweet tooth, but I'm surprised I don't have too many cavities, but I did open my mouth and I found one metal cavity in my mouth. And as per this book, basically every time I'm chewing or every time I'm heating up my coffee or my chai, I should say, I'm releasing mercury into my system.
Yeah.
And we know how bad mercury is. So then how can we change that? How can I change that?
You'd have to go see your dentist and ask him what the best, him or her, I should say, is the best way to remove it. Now, I've been blessed that I worked in both a dental office as well as a biological dental office. So there's two different ways of taking the mercury out in the mouth. So if you go to your dentist, they'll basically freeze you, they'll take it out, and they have the suction while they're removing your fillings for you, the mercury. And then basically you're done after the appointment, and they'll go to the front and you pay for it and you go home. But what I noticed was a lot of the people who had mercury fillings taken out had inflammation of some sort or an infection. Okay, so that was the difference that I noticed. So in a biological dental office, we do things a little bit different because we look at the teeth compared to your overall health. So it's not just your teeth, we look at your body. So after filling out the questionnaires, what you're allergic to and what you're not, we also go through a system. So the protocol is we see what's compatible to your body. So we have a machine. When I was working, they had a machine called Vega testing. So they would see whether or not that material would be compatible to your body. Okay, so step number one. So now that you're getting ready for your taking out the fillings, you actually, the day before, you don't take your vitamins or your primrose oil or anything like that, because what we say is that the vitamins may interfere with the anesthetic when you're being frozen. Then the other thing that we tell people that are patients is that they need to take charcoal with cilantro. And so so what that does, that combination does, is it removes the toxins. It helps the toxins to get rid of, comes out of your system. So it binds it when you're actually, for whatever reason, it releases into your system. It helps to get rid of it. So the next step would be, we would have the patients go into the chair and they would be given an oxygen tank. So they would be breathing in oxygen, not the vapors itself. And not that I'm trying to scare anyone, but the dentist would be wearing a gas mask, and as well as their CDAs, their chairside assistant. And so, basically the patient is, even though the hot drill is releasing the vapors of the mercury, they're given the proper oxygen that they need. And then after the treatment, what they end up doing is this dentist offers you to, actually mentions that you should go to get an IV sedation. So IV of vitamin C for helping to boost up your immune system, because we know that the mercury lowers it down. So we give them the antibiotics just in case, but a lot of them don't need it.
Well, thank you. That was very informative, Cyrene. Definitely something that we wouldn't have known, that there's two different types of dentists. You've got your more natural dentist, and then you've got like the regular dentist that you would go see. And so there are safe ways to have your mercury or your filling removed so that you don't have the mercury toxins inside of you. Now, we can keep going about our pearly whites. We do want to keep them white, and we want to make sure, even at home, we stay away from the fluoride. So there's other options. But moving forward, another thing that we need to be wary of is our medicine cabinet. Like how many antibiotics is one taking, or do you have all these medications that have expired and shouldn't even be in your cabinet, just in the off case that you may need to use it one time?
Well,
I just have one. That's it.
this one.
Yeah.
Well, we go through our medicine cabinet every year just to make sure that there aren't any expired products. And we have to do that, excuse me, because of my kids' allergies, and they have an EpiPen. So we make sure that those aren't expired. And then also some of the other products that we've accumulated over the years. But I'm all for one to always try to not just reach for the medication. Like if I have a headache, try to look for other ways of getting over it than to just pop pills. There's times I need it and there's times that I don't. So I think, again, just being aware of maybe finding out what you do need really, versus relying on just grabbing something out of
Mhm.
the medication.
So it's about
cabinet.
learning to listen to your body.
Yeah,
Yes.
yeah.
Because the headache today, if somebody has a headache, they just want to mask it.
Yeah.
And I'm like, well, if you have a headache, it's your body itself is trying to tell you something.
Yeah. What's causing it?
Number
know?
one thing, your dehydration.
Yeah, a lot of the time is the water, but sometimes it's you've got to think about it. Is that something that you were smelling, like you, Cyrene, like that gives you a headache, or Fatima, Is it something that you've eaten? Is it something that is stress, or, and then deal with it this way? I'm like John, like my medicine cabinet doesn't really have anything because we we don't really use any kind of drugs or anything like that, and we don't have no reason to either. For you, like you have the reason to do that because some allergies and stuff, but we're fortunate enough to not be in that boat, I guess. And yeah.
And
So-
for me, so my personal medicine cabinet, I don't have anything. I have absolutely nothing in my medicine cabinet. The only thing I do keep is an Advil in the event that I do get a migraine and it's like unbearable, but I'll do everything naturally before I even reach that for that Advil. Now the funny thing is, if you look at my medicine cabinet downstairs, it's full of like shit. Like, pardon my French, but it's just full of like a bunch of stuff. And the funny thing is, my sister's a pharmacist, so it is going to be full of like a whole bunch of things because for her, that's what she believes in, and that's what my family believes in. Well, I'm all about doing it naturally. When I get sick, I will not take any medication unless I will not take a single antibiotic unless I have to take it and it's at a point where it's just not healing.
Yeah.
I'd rather do it all naturally because our body heals itself.
Yeah. It's like we're suppressing our own immune system by using what the pharmaceutical companies are kind of teaching us to use to mask something.
Yeah.
And then and a lot of people do that with their kids when it's their prime time growing and their immune system gets stronger, and then we mask it with different things like vaccination or cough syrup, so things like that to fix a problem. But the fact is that it's to the detriment of our own immune system.
Exactly. And not only that, but it also affects different, there's different symptoms with each one. And some of the drug compounds, well, when you're mixing them, causes some sort of other reaction. Perfect example. So when I had tore my hip flexor ligament back in 2010, when I couldn't walk, I was on extreme painkillers because boy, was I in a lot of pain. I couldn't even walk. And I was taking Celebrex and also naproxen. And these are two very, 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 very strong ibuprofens, which you have to take with food. And what I noticed is, yes, my pain was gone, but one, I was a lot more groggier. Two, I was constipated. Three, my emotional and mental well-being was gone out the window. So basically, I've always been someone who's very patient, and I'm sure you guys can tell that I'm pretty patient and I'm easy-go-lucky for the most part, but this was crazy. Like a pin would drop and I would lose it through the roof. So I started noticing all these shifts, and I'm like, this is not me. Like, this is not someone who, who is. And so I was just like, I'm not gonna take these. I'm not gonna do anything. I'm gonna deal with the pain in other ways. And so I slowly got myself off of them. And these two are actually very addictive. They, like, you have to get a prescription for it, and you can't get a refill just like that. You have to get, so imagine I was on it for about 3 months, and I'm noticing all these changes. So I had to I got myself off of it because I didn't want to be addicted. I didn't like who I was becoming. And so now if you're taking multiple, then your kidney goes, then your heart goes, and your skin goes, and what's next? You're a bucket of,
Hurt.
yeah.
It is. But admittedly, I have a friend of mine who's has high blood pressure, high cholesterol, diabetes, and he's taking a lot of medication. And he knows the side effects are bad, and he decided to stop everything. And I'm like, what? He's like, I'm free from all medication. And to him, it was like a liberation.
Yeah.
And I said, so what did your doctor say? He said, I've never told my doctor. And I'm like, oh my God, like I would never recommend someone to drop all medication. But I said, you should just go to your doctor and say, look, I'm taking too much. So what can we do to reduce it? And admittedly, it comes with what food you're eating, what are you exposed to, and then everything will decrease. And in the meantime, the doctor will decrease your medication little by little, but not
Cold turkey like you.
Yeah. Well, cold turkey, I do that, but probably not for medication. Because if the doctor gives it to you, it's for a reason.
Yeah.
And then the ball is in your court to decide if you want to do the research, if you can get better another way. Because doctors will give you the chemicals to fix the problem, but there's other ways.
But people are going to see their medical professional because they want a quick fix, right? They have an issue, they have a pain, they have an illness, and they're asking for that quick fix, and the doctor's going to give that to them because that's their role.
Without having
is
to
help
change
you.
anything else.
Yeah, and they don't look at what the root cause is. So I think if you have these constant headaches, you have constant pain, you have constant, it keeps coming back. I mean, that should be a signal for you to kind of look back and say, what's causing it? Because, and that's the hard part, is people are always in the cycle that it's normal every spring to get allergies and they have to go and take the medication, or every winter they're going to get back pain or whatever it may be. So they're already, it's part of their life. And to break that cycle is where hopefully people can kind of make that little shift, is to, hey, wait a minute, I've been getting this every year for the last 10 years. Maybe there's something going on, and just kind of see something. Yeah.
And so we could be completely clean of antibiotics, but as a chef, you probably agree with this, that a lot of times in the meats, and that's probably why you've gone vegan, that there's antibiotics because they use those hormones to have meats grow faster. So what's one way that you can, not everyone's going to go vegan.
It's not the reason why I went vegan, but the reason why I went vegan is because there's more nutrition in fruit, vegetable, legumes, and also meat and dairy is acid producing, and fruit and vegetable brings your body more to alkaline, and nothing grows in alkaline, but everything grows in acidity. And so it's one of the reasons, just to be healthier, I guess.
Mm-hmm.
More and more people that raise animals, beef, stock, or pork, or whatever, they try to go as natural as possible. But we also need to be careful of those saying natural, because natural is a big word, right? And anybody can use it because there's no regulations on who can use the word natural. And they say that the beef you're eating is free of antibiotic. Well, is it really? Is it in their food, or, But yeah, most common meat product has a lot of chemicals in them.
I found a place on Commercial Drive from a butcher, and the butcher has grass-fed finished and free range, and they actually have a picture of their farm on the wall, like on the wall, and you feel comfortable. And when you walk into this butcher shop, you don't even smell like it's a butcher shop. You know how sometimes you go into a
They
store
probably put the plugins.
and it's so pungent. This one doesn't. You walk in there like, whoa, I believe it's, free from antibiotics and hormones. And
But you also just to add to it, you also have to be careful of what they're showing you, because they're showing you what the customer wants to see. Because I've seen it in endless cases, and it's not because I'm vegan that I'm researching this information. I just see it where companies are saying our chickens are free range and yada yada yada, and they're showing pictures and videos. But then when you go to the actual farm, they are not at all. So you really have to be. If you trust them, it's good.
I do trust them.
And that's what they want to create, because they need the sales. Whether it's true or not, for some company it's not, but it's just the way it is.
But that's all more reason to find out again. Like we're talking about how people are getting sick every year and how you can prevent it. But it also goes back with our food, is to get to know your farmer, right? Get to know your gardener or our farmers and the people raising the meats, is to, if they're close by and you are able to buy locally. I mean, it may cost a little bit more, but at least you know what you're getting. And also, we've been cutting down meat. Like we've been cutting down eating meats quite a bit, not as much as what we've eaten, 15 years ago, at least for myself. And so, when you do eat meat, yeah, if you're paying a little bit more, you're not eating it every day, so it's not going to be crazy, to buy it. So it is kind of like a treat. It's just once or twice a week we'll eat beef, but it better be organic and certified.
Yeah, so these are excellent, suggestions as to how we can make sure that we're not getting the antibiotics in our meat. Go organic, know your farmer, and maybe even go vegan. But now, what about antibacterial products? I mean, it's a hot topic right now. It's a very hot topic. Are you better off washing your hands with soap and water, or antibacterial like a hand sanitizer?
It's a really hot topic right now.
Yes.
And I, to be honest, I just wash my hands, and I've always have. And I'm not the kind of guy that's gonna go and put some alcohol and rub it and make sure. There's studies out there that shows that just washing your hands for like that 20-30 seconds is getting rid of pretty much everything.
Yeah.
Yeah. John, did you
and
want
there's
to
a
say
lot
something?
of chemicals that I don't agree with all these antibacterial.
Again, went to a grocery store the other day and they were handing out the wipes, the wipes and the
Yep.
sanitizing gel. And so they're being cautious. That's good. They're protecting the customers and themselves. But after I used the gel, I went home and I washed my hands as well. I couldn't get the smell out of my hands from the gel.
Yeah.
Like it smelled like flowers, like potpourri, and it was, I didn't like it, but I could not get it off of me. So, I would have rather just them give me a sink soap, right?
Yeah.
And then I come home and I wash my hands, and like last night or the whole night, I still couldn't get the smell out of my pores in my hand. So imagine, again, we go back, how much of it is going into our body, like into our skin, right? Deeper.
Yeah, so that's right. Like, I mean, usually the best rule of thumb is wash your hands with water and soap for 20 to 30 seconds. But if you're at a place where you're in the grocery store, you have no choice but to use those wipes or to use the hand sanitizers. But that shouldn't be your be all and all. Make sure even after you're washing your hands, because guess what? There's alcohol. So you don't want to have your hands burning on you, right?
And alcohol dries out your skin, so you're gonna have dried skin and cracked cracked hands.
That's right. So you'd have to use a lot of moisturizer, again, unscented. So then that way you're not smelling that scent of potpourri.
Wear
Well,
gloves.
at our gym, we basically have, when we come through the door, we're handed a hand sanitizer wipe. So we have to use it before we actually start working out in the gym. And the last thing we do is use a hand sanitizer soap before we leave. But my hands are itchy. I'm reacting to the stuff on it, you know, and I can't wait to get home to wash my hands.
Yep.
And plus, you know, when you're using all these hand sanitizers, maybe several times a day, you know, we do have to have good bacteria. You know, there are good bacteria that is on our body. And so when we're using a lot of these wipes and gels and sprays and so forth, they may actually be taking away some of these good guys that we need. So, you know, washing our hands with soap and water, yeah, it does take away most of what we're afraid of, but it doesn't take away some of the good stuff. Where you dip your hands in alcohol a day, you can have 0 germs, but that lets down our guard as well. So it's kind of like this cycle that like how much and you know where and when.
Yeah, it's just having that happy medium and doing your research before anything. So in the book, it's also talking about like vaccines. Like, you know, some people do get the vaccines and some people don't. So we're not going to really go into detail. But again, vaccine is another big topic. And the book discusses in depth as to why you should not be getting the vaccine, because you're adding the chemicals that shouldn't be into your body. That's the simpler reason. But in order to actually dig deeper, you're going to want to read the book, and that way you can find out more about what is in the vaccine and why you don't really want to be taking a vaccine. And on that note, that brings us to an end for this topic. So if you haven't already, like our Facebook page, The Healthy Way Vibes. Also, make sure you're commenting on all of our posts, comment below. And if you have any questions, please put them in any of our comments, any of our videos. We will be checking them. And another way, you also have to tag 3 of your friends and share the post onto your page. So if you have any questions or anything, please put them in the comments below. And hopefully you're one of the 4 lucky winners that will win one of these amazing books. Like it's just, as you can see, I've got notes everywhere. I'm sure all 3 of you have your notes everywhere and on paper and everything. So you're gonna want to get your hands on this copy because there's nothing on Amazon, and it is a bestseller. So that brings us to an end for today. Hope you had a wonderful time, and we will see you the next time. Bye for now.
Bye, guys.